hygiene skill. So first I'm just gonna turn the water on, adjusting the temperature. I'm just gonna wet, making sure not to touch the inside of the bowl. Working my hands into a lather. Washing my wrists. And underneath my nails. Making sure not to shake my hands. Don and remove my personal protective equipment. So I'm going to open up the package. Before I do so, I'm going to wash my hands. If there was a table right here, I would open up the covering on the table, but I don't have one. So I'm just going to open it, making sure not to fan it or shake. I'm going to tie the ties in the back. Making sure not to tie a knot so that it'll be easier to remove. And then I'm just gonna don my gloves. Making sure to pull it over the covering on the wrist. Okay. All right, now for removal, I'm going to pinch the inside and pull it off, ball it up in this hand. I'm going to reach underneath the glove. Now I will dispose of it properly. Without touching the outside of my covering, I'm going to untie the strings. Reaching my hand on the inside. And then I'll ball it up so that the outside is in the inside, and I'll dispose of it properly. After that, I'll wash my hands. All right, so I'm gonna check orders and authorization, assemble my equipment and supplies. Hello, Miss Lee.
Hello.
My name is Journey Williams. I'll be your CNA for today. And today I'm just gonna be putting an elasticized stocking on your leg. Then we're gonna do a little bit of range of motion on your shoulder. And then after that, I'm gonna check your respirations, okay?
It's fine.
All right, so I'm going to provide privacy for the patient. I'm going to wash my hands and put on my clean gloves. After that, I'm going to make sure the bed is elevated to a comfortable working height, the brakes are locked, and the side rail is elevated on the side that I'm working on. All right, so first, I'm going to make sure that the stocking is the right size for the patient. Okay, I'm gonna make sure that it's clean. And I'm just gonna turn it inside out. And then I'm just gonna place it on the patient, okay? Making sure to support the patient's foot and leg. While I'm doing this, I'm gonna pull the stocking up, making sure that there are no wrinkles or creases. Okay. I'm gonna make sure that the opening is above the toes. I'm gonna make sure not to stretch the stocking. And then I'm just gonna recover the patient. All right. Now I'm just gonna do some range of motion on your shoulder, okay?
Okay.
All right, so first we're gonna flex and extend. All right. 1, 2, 3. Okay. And then we're just gonna abduct and adduct, all right? 1, 2, 3. Are you feeling any pain?
No, I'm not.
Discomfort?
No.
Okay. Okay. So I would record that her respirations are at 19. So I would write R19, strong and deep. After that, I would just replace all of my equipment and supplies, making sure that my area is neat and clean. Are you comfortable?
Yes.
Okay, I'm gonna make sure that the patient is in correct body alignment. Again, making sure that the brakes are locked, the side rail is elevated. I'm gonna make sure that the call signal is in reach of the patient, and then I'm just going to report any abnormalities, and that's it.